All right, so I'm going to be discussing your OSCE station for appendicectomy. So the question was, can't remember completely, but I know basically what it was talking about was a young lady, maybe a 20-year-old Babcock student, who was supposed to have appendicectomy, and you are supposed to counsel her. All right, so pay attention. The principles of answering, of tackling counseling or consent taking. Yeah, it was to take consent. Yeah, it's to take consent. I remember. The principles are quite simple, but you need to understand the concepts. Here, you are trying to make a patient decide. Informed consent is such that you are giving the patient all the information that is required to make their decisions. Okay, even though that's the treatment you have advised, the patient has every right to decide whether or not they want that treatment. Okay, so now the issue here is that you must explain the condition to the patient, right? You must give the patient options of treatment. You must explain all the treatment entails, including the complications and so on. So what I'm going to do now is I'm going to tell you what is required. Okay. Because whatever is in the checklist is in the checklist. If once is in the checklist and you do it, you get your marks. If it's not in the checklist, you can talk from now till eternity. It will not make a difference. All right. So you are expected to greet the patient and the examiner. So people just came in and started talking. So you come in, you read the question, give the examiner your matriculation number, greet the patient and the examiner. You need to create a rapport. Smile at the patient. Oh, hi. My name is this. I'm supposed to make you consent to a surgical procedure. Are you aware of that? And then you just go into the discussion. Don't just say, oh, well, no. Now, some people waste time with biodata. What's your name? How old are you? What work you do? Are you married? Are you not in surgery or ski? It may be different from medicine or ski, but not surgery or ski. Surgery or ski, all you need, in fact, we have given you the age of the patient already. Giving you the age, we've told you that she's a student. There's no other information you need there. You don't need the name. What do you want to use the name for? But if in medicine, they can ask you in the follow-up question, what's the name of the patient you just collect? They would have told you can't do that. But in surgery, we don't do things like that because the name of the patient in this setting is not important. So you then go on to explain the diagnosis and the indication. So you must tell the person what appendicitis is. Just say it in 2 sentences. But that's different. You don't go in and start explaining obstructive and cataract appendicitis. You just simply say it's inflammation of the appendix. It can happen in some situations and it leads to pain. Sometimes people vomit, they have fever, and sometimes it can even burst. And the reason why we want to do this surgery is to prevent it from bursting, prevent pus from forming inside you, which can lead to further complications. So once you say that, you get the mark for explanation of the diagnosis. You would explain the types. This was where many people made mistakes. They didn't explain the types. They just assumed that it has to be open appendicectomy. It doesn't have to be open. The developed world, appendicectomy is done laparoscopically. So if you don't mention it, you've done something that is seen as an error. You must explain the types. You must explain the benefits. Why do you want this patient to have appendicectomy? You must explain the procedure. So if a patient is going to have this procedure, okay, as I'm explaining to you now, you have to come in a day before the surgery. We'll allow you to eat the day before, but from 12 midnight, you will not be allowed to eat or drink water. We'll give you anxiolytics. We'll move you to the theater. The surgery will be done under, is it general anesthesia? Is it spinal anesthesia? We don't do appendicectomy under local anesthesia. So you must give the patient the standard options of anesthesia. All right. So you must then explain that procedures just takes a few minutes and then will be done, and then you'll be transferred back to the ward. Or is the patient going to ICU? If it's for a condition where the patient needs ICU care, then you mention it. Then you must explain the complications, possible complications. Now you don't have to list 10 complications, just take like 2 or 3, such that the examiner knows that this person has mentioned complications, because your time is going. Okay, so most people spend all their time on complications, so thereby getting only marks for complications. Then you must ask about the patient's concerns. What are your concerns? Very, very important question in this station, because it carried a lot of marks. If you don't ask patient for concerns, you may not do well in this station. And they've told you this is a young female backup student. What are they concerned about? It's cosmesis. All right, so you must ask about the concerns, and this is an example of what you then find in the follow-up station. Is questions about cosmesis. After that, you now ask, do you understand everything I've said? Yeah. Do you have any questions? So you see, your questions here is based on what you have explained. Do you have questions based on what I've explained to you? Is different from, do you have any concerns? Yeah, different. So concerns are more or less like, oh, you've told this patient that he's going to have this procedure, so they may have some worries. They might, so for example, when you want to operate on the neck of some patients, they'll come and tell you that they told them that once they cut somebody's neck, the person will just die. Or this, you want to do surgery, you want to do hemorrhoidectomy, and they say they are going to have erectile dysfunction. Those are the concerns of the patient. That's nothing to do with what you have said. So what I'm going to do now is that I'm going to go through some of the things that I noted that you guys said. Many people were not organized. They just came in and just started rambling. Okay, somebody came in and said, we will do open because it's this part of the world. No, when you are in an examination setting, you don't think part of the world, whether the patient doesn't have money, whether you are going to contribute money for the patient. No, you don't put that in it. Exams are standard. You just tell the patient what is standard. Okay, so you don't say that we are not going to do the right thing for you because we're in this part of the world. No, not in an exam. Somebody asked, somebody said you have a headache, maybe from I don't know, maybe after spinal anesthesia, and he says you will have a headache, but that's not a problem. What do you mean by that's not a problem? So headache cannot be a problem. What do you mean by that? So be careful of the things you say. Don't say whatever is non-necessary. Some things are said that are non-necessary. Somebody talked about you're going to pass a nasogastric tube for you, going to pass a catheter for you. Once we hear that, it's obvious that that candidate has not been coming to school. We do not pass nasogastric tubes for uncomplicated appendicectomy. And that's obviously what this is. So box there with appendicitis. So you will not pass a nasogastric tube. We may not even pass a catheter. Sometimes the anesthetists want catheters for patients in theater, but the catheters are removed shortly. Somebody was talking about complications. I was talking about strictures. What does that even mean? So don't just talk anyhow. Somebody said we are going to do an exploratory laparotomy for appendicitis. Somebody says they will take out sutures. Take out which sutures? We'll come back to take out the sutures. Somebody spent all their time talking about biodata. Somebody was explaining to a patient and was mentioning hemorrhage. Does the patient know what hemorrhage is? Or mentioning Mac-Bonus point, that we are going to make the decision over your Mac-Bonus point in a consent taking station. Somebody said we have to do bowel resection for appendicitis. Somebody says you will not eat for 2 days. What do you mean by patient will not eat for 2 days? It means you've not been coming to school, right? Somebody said local anesthesia for appendicitis. No. Somebody said the appendix is useless. That's why you are removing it. How can you say the appendix is useless? Avoid whatever does not need to be said. If you are not sure of it, do not mention it. Don't say the appendix is useless. He said that there may be cancer in the appendix. Why are you complicating matters? Somebody made a statement like, will not leave you to die if you have a complication. What was that? Will not leave you to die. There's some people spend all their times detailing anesthetic complications. It's not an anesthesia question. So don't waste your time on anesthetic complications. If you talk about anesthetic complications, one is okay. Somebody talked about abdominal x-rays and CT scan. Somebody talked about interval appendicectomy. For a 21-year-old here, they will say as acute appendicitis, or you just said appendicitis, and you are talking about interval appendicectomy. So the patient should go home first, then come back, then that's when you take the consent. Somebody was talking about complications and said there's a possibility of dying under anesthesia. And you think that dying, saying patient may die under anesthesia will give you more marks, right? Anything that you don't explain, not get marks for, which is why you should explain them. And that, like I said, don't give too many details on complications. So people forget to tell us their numbers. The question is not consent on complications of appendicectomy. It is take consent for appendicectomy, right? So the complications are not everything. So I believe that this will be helpful. I will probably make further videos as time goes on. What usually happens is that those that it's just like the youngest in the family, they get to enjoy a number of things. The oldest has suffered a lot. So the younger ones will see more of these videos, and of course, they will learn more and probably do a bit better. But it's all the same. I wish you all the best in your exams. Bye.